Welcome to the Fertility Rewire podcast. I'm your host, Kat Stevens, a fertility therapist, coach, educator, and advocate. What I hope for you is that the journey you are on can become simpler, less uphill, and through sharing information with you, I can not only start to give you the answers, but perhaps more importantly, arm you with the questions you didn't know you needed to get you the right information to guide your journey. You can find me on Instagram and other socials at Fertility Rewire and via my website fertilityrewire.com, where you'll find free resources and ways to work with me, sign up for emails, and where you'll be the first to hear about what's happening in my clinic and latest offers. I really hope you enjoy the podcast, and if you want to get in touch, you can reach out in comments on your podcast platform, on YouTube, or you can drop me a line at kat@fertilityrewire.com. Hi, and welcome to episode 51 of the Fertility Rewire podcast. And in this episode, I'm going to talk to you about why you must not accept normal and you must not accept unexplained from the fertility tests that you have. So that's quite a bold statement, isn't it? I'm working with clients, as you know, as I've talked about before. And one of the things when we're working together, if they haven't already had tests, they haven't already had blood tests, hormone profiles, then this is something that I actively encourage them to have. And then often what happens when they get their results back is they say, oh, the doctor said everything's normal, so it's unexplained. Their doctor said there's nothing more that they can do at their end. And I always ask at this point for them to get a copy of the results so we can have a look at the copy of the results together. Now, what this shows us more often than not is if you think, for example, thyroid stimulating hormone, I would encourage you to always have your thyroid tested if you are experiencing fertility issues, or even if you're just starting to think about trying for a family. Look at the thyroid stimulating hormone, TSH. Now, the way the thyroid stimulating hormone works is that the higher the level of thyroid stimulating hormone in your blood, the lower your thyroid activity is. Okay, so a high TSH would show us that your thyroid is functioning below par, or that it is an underactive thyroid. And the reason for that is that your body is producing this stimulating hormone to stimulate your thyroid. And the more stimulation it needs, the poorer it's working without it. Does that make sense? So if you have a low TSH result, a low thyroid stimulating hormone, then your thyroid isn't needing any help. It's functioning well, and maybe it's functioning too much. And that's when we get into a hyperactive thyroid issue. So when we look at these guidelines for thyroid, generally, you're looking at a normal range being between, and this is UK, and this is also in the NHS trust that I am positioned in, the primary care trust here in the part of Nottingham. And there is a slight change in some parts of the country. So I saw some test results this week. So these are the test results I'm talking to you about. The reference range, so that is the range of the low, and below that, the medical profession need to give you treatment, and high and above that, the medical profession need to give you treatment. And that range is 0.27 to 4.2. So that's in milli units per litre. That's the reference. So MUL. 0.27 to 4.9. Okay, so below that, you've got an overactive thyroid, you're demonstrating ill health. Above that, you've got an underactive thyroid that will need something doing, you're demonstrating ill health. And what we have to realize, ladies and gentlemen, is that our medical model of healthcare, which I adore and we are so blessed to have, but our medical model of healthcare is to treat ill health. It is to treat at the point that health is affected. It is not about, oh, well, you're a little bit on the low side, so perhaps you might want to look into different ways to support your thyroid. That doesn't work. It's very cut and dried. So I have a client this week who has had her results back and her thyroid is 4.2. Now, that's not far off 4.9, is it? But it's normal. Now, in terms of pregnancy and fertility, if you Google what's the optimum TSH for fertility, what you will find is research articles suggesting that less than or equal to 2.5 is where you want to be. 2.5. And this, ladies, is 4.2. So we're working together, looking at ways we can support her thyroid through other methods to try and bring that function of the thyroid more into balance. And what is really significant about this? Well, there's a couple of things. One is, and I'm sorry, I am going to talk about stress, but cortisol massively affects the thyroid function. So if you have stress, if you have cortisol at significant levels, your thyroid function will be affected. So that's one aspect that we need to look at. But when you look at recommended thyroid stimulating hormone levels in pregnancy, so the first trimester of pregnancy, it is recommended that the TSH be between 2 and 2.5. So here's the thing. Your thyroid could be 4.2 while you're trying to get pregnant. A week later, the medical advice is that they want that at 2.5. So doesn't it make sense that it would be at 2.5 or less ideally? And some fertility clinics will look at this and will support that thyroid function, to give you medication perhaps to support that. But I don't think widely, certainly not in the UK. In the US, absolutely. In the US, when I'm working with clients in America, if they have a thyroid of above 2.5, they are getting treatment for that. I also have a client in Europe who's also had treatment when her thyroid function was suboptimal. And this is what I want us to think about. Let's forget normal. If you are out of the range, it is unhealthy. Okay. If it is within the range, but at the lower side or the upper side, it is suboptimal. If it's in the middle, we're looking more at optimal. So get your test results and have a look at them. When it comes to ferritin, now you may not routinely been tested for ferritin, but this client that I have, it was one of the tests that we talked about and that she requested. Her ferritin has come back as 19. Now, the ferritin reference range is huge. It's something like, and I don't have this to hand, but I think it's 5 is the lowest to 265. Now, ferritin represents your iron stores. It doesn't represent the iron in your body. That's in your hemoglobin, your red blood cells. It represents your iron stores. And you are symptomatic as a woman generally if your ferritin is below 50, but 5 is normal. I'm doing little inverted commas with my hands. If you're watching on YouTube, you'll be able to see that, but I will just explain that if you're listening on a podcast or audio. So at 19, I would say we can do more with that. That's suboptimal. We can improve that. We've got room for improvement there. And lots of articles, when you Google and you look through advice about ferritin, in Australia for sure, and also in America, is suggested that a female's ferritin level should be no lower than 30 or 50. Okay, some say 50, some say 30. So at 19, I would say that's a little on the low side when you're looking at getting pregnant. And also, if this client were to be pregnant and her ferritin was tested, they may want to support that with some iron supplementation. So there is this window, isn't there, between trying to get pregnant and being pregnant. Fertility is about trying to get pregnant, and you could be pregnant within that cycle of trying. And only when your pregnancy is confirmed are we then going to look at these test results. So it makes no sense to me at all. I also have clients who have tested positive for thyroid antibodies. Now, I'm skipping back to thyroid now, sorry to confuse. So thyroid antibodies, if you have those, it represents an autoimmune element, and that you have these antibodies working against your thyroid. And the practice in the UK is if you have thyroid antibodies, then actually what that means is that you will get low thyroid at some point. And so we'll monitor you. And when you do, we will give you the medication. I have a couple of clients with thyroid antibodies that they found out through private testing. And we have taken measures, and they have used different sorts of support and different nutritional support. And although that's not going to change the antibodies necessarily, you could see their thyroid function. You could see the low temperatures on their basal body temperature chart. The different symptoms they had led us to look to thyroid. But actually, by using the different support mechanisms they're using, their cycle has changed phenomenally. Their symptoms have changed, their bleed has changed, their ovulation is clearer. And there's lots about ovulation and thyroid. There's lots of research looking into that. Thyroid levels are so important in pregnancy because there is such an effect on your thyroid stimulating hormone on the growing fetus. And so it is so important that this thyroid level is optimal while you are trying to conceive. Okay, so if you haven't had your thyroid stimulating hormone tested, and you're on a fertility journey, I would suggest that you get that tested, especially if your basal body temperatures are below 36, if you're testing in Celsius. And also if you're experiencing tiredness, perhaps you've got issues with your hair or your nails, that can be an indicator as well. And sometimes there aren't clinical indicators, because remember, we see those at ill health, but we know that in normal functioning, we want to nip that in the bud as soon as we can. You'll know with normal, I've talked before about sperm analysis, that we will accept that 4% normal forms of sperm are fine, because that is the lower level of the range. So we accept 96% of sperm as abnormal, being fine. Are you happy with that? Are you honestly happy with just okay? Or do you want to make this as better as you can? As better as you can, as best as you can, perhaps. Yes. Do you want to make this as best as you possibly can? Because remember, this isn't about or just about getting pregnant. This is about getting pregnant with a healthy baby that will go to full term, a healthy baby. It's not just about getting pregnant. So when we're looking at factors, so for example, with low ferritin, iron deficiency is linked, yes, to fertility issues, but also to low birth weights of babies, to miscarriage, and also preterm delivery. And there's very similar risk factors when you're looking at thyroid dysfunction as well. Okay, so that's just thyroid and ferritin. Okay, when we get on to look at further aspects, like if you're just inside for your follicle stimulating hormone, or you're just inside for your progesterone, let's make it better. Let's not accept normal as okay. Let's make it better, because normal means you're not unhealthy if you're at the lower or the higher level of the range, but you could very easily be. Another one before I go to think about is vitamin D. And I would suggest that you always get your vitamin D tested. I think I've mentioned this before on a specific podcast, but I worked with a client who was working with Leeds Fertility Clinic in Yorkshire here in the UK. And it was brilliant because they tested her vitamin D and they wouldn't start the IVF until her and her partner's vitamin D were at optimal levels. So it does happen in some fertility clinics. It's not going to happen at your family doctor level. So this is where you need to really inform yourself and look into ways to improve your results, because it is possible. It is possible. If you want to know any more about that, if you want to have a chat with me about that, if you've got a question you want to ask, drop me a line at kat@fertilityrewire.com, or I'm on Instagram at Fertility Rewire. And, you could find me that way, or put something in comments here on YouTube or on the podcast. But I hope that makes sense. I hope that has given you something to start to look a little bit further into. We must not accept the word normal. We're looking at optimal health of you for your fertility, and optimal health for your baby. All right. Take care then. Bye-bye. You've been listening to the Fertility Rewire podcast. I really hope you found it helpful and perhaps thought-provoking. Feel free to reach out and connect with me on Instagram and other socials at Fertility Rewire, or drop by my website, fertilityrewire.com. If you have any questions, please reach out either in direct message or direct to me at kat@fertilityrewire. Until next time, take care.